we'll get started now with Daryl Stephenson, who's the ergonomist, also in the Hamilton Clinic of OCOW, and his PhD actually involved qualitative analysis, and so we have roped him into helping us hear more from the results of the stress assess surveys, and also now today he's going to present on the comments that were included in the pandemic experience survey and what more insights they offer. So Daryl, take it away. Thanks.
Great. Can you hear me okay?
Yes, it's too good. Thanks.
Okay, yeah, so thanks for the introduction, Val. And I'm going to be commenting on the qualitative comments that were in the survey that John and Peter just went over. So the objectives here for what I was trying to accomplish was to try to contextualize the findings of the survey with the open-ended survey comments. And the comments hope to provide a living narrative behind the quantitative findings of the survey data. And I hope to highlight the diverse range of ideas of how stakeholders might address the sources of stress and control the psychological hazards during a pandemic. So the methods were, we took the survey tool that John and Peter just went over, and there was a question at the end that was, what else might help you do your job more effectively? It was an open-ended question format. So I used a program called In Vivo, which just helps organize and helps you code and create themes out of comments. It's a qualitative analysis software. So what we did, we looked through the comments, and I analyzed and organized the comments. And then I went through and either by word or line by line or a whole paragraph, I would try to code comments into different codes. And then from there, I would take these codes and condense them down and create themes. And then I would take these themes and compare them back to the other comments and see how they fit and see if other comments might fit. So it's a very iterative process of coding. So there was 1,475 comments that I went through, 35,000 words worth of comments. And from there, I got 199 initial codes that were created. And these codes were categorized into themes, and I came up with 14 themes from that. So here are the prevalence of these 14 themes. So this chart shows the number of times each of these themes were referenced. And within these themes, there's a number of codes that add up to create these themes, which I'll show next. So as we can see, the highest number of references was actually around communication, working from home, support, treatment of workers. Then it was access to better technology like internet and computer equipment, time management, COVID safety policies, PPE, having information and training, access to actually do their work and do their job, leadership, mental health, job security, and working with others. So this next chart is a similar chart. It's a hierarchy of the codes. So the bigger the box, the more times that they were coded. So as we can see, if you look at the left side of the screen, in the green box, it says working from home. It's that second category in this chart here. And within that, we have things like ergonomic issues with the home office, childcare, children stressing work at home, and being content with working at home. And so as I go through this presentation, I'll kind of go through each of these themes and what makes them up. Okay, so I think you guys got a good look at this while we were answering some of the other questions. But this is one of the ways that that program can kind of do some analysis on its own. And this is just a word cloud of the most frequently used words. So we see things like communication, management, time. The word better is in there because there was a lot of better communication, better time management, better COVID safety policies, things like that. And so training. So it's kind of interesting to see. So the top theme again was communication. Better communication between managers and workers was actually referenced 100 times. So every time one of those was referenced, it actually had the words communication and management within it. Better communication overall between staff, colleagues, and just the word better communication was referenced 52 times. And then there was a lot of discussion around honesty and transparency, especially with the communication. And then it was interesting to see that some people wanted more frequent check-ins and more communication, whereas some other people said that they wanted the opposite. They wanted less pointless meetings and check-ins like that. So again, the access to better technology, equipment, and internet was a big one, 127 references. So people wanted better computers and equipment to work on at home. They wanted faster internet, especially in rural areas. They found it difficult to communicate um, through different ways because of their internet. They wanted access to virtual private networks and different communication devices, whether it's a phone to work on, provided by the workplace. So another big theme was around COVID safety policies. So a lot of people just wanted better COVID safety policies to feel safer at work. They wanted clear direction from government and ministry. They wanted to have clear and consistent policies, and they wanted to know if coworkers have COVID. And obviously, there's some confidentiality issues there, but that would make them feel safer if they knew who had the symptoms at work. So having proactive protocols was mentioned. Better cleaning protocols was mentioned quite a few times, and having cleaning support. Um, More testing of the general public, clients, patients, and customers, and knowing that they feel safe. Testing for frontline workers. And one big interesting topic was workers not understanding why their jobs are deemed essential and saying, why am I even going to work? I don't think it's safe and I don't think my job's essential. PPE, more or less the lack of PPE was a big topic that was brought up. I remember a lot of these comments, people had the chance to actually answer these within the survey itself. So if they're bringing this up, it's the second time that they're bringing these issues up. So it's really important to them to have this message brought forward. So 75 references were calling for a need for more or better PPE in their workplaces. Many frontline workers were very upset by the lack of PPE given to them. Many did not feel safe reusing the PPE. Many talked about having to use the same PPE for a week straight, and they didn't feel safe doing that. And then there's talk around better PPE disposal guidelines. Okay, so working from home was a pretty big topic. Definitely the most references were with ergonomic issues and people having to work from the couches, not having a computer chair, all people working from laptops and not having external monitors, and really having some issues working ergonomically from home. They also had a lot of issues with childcare and the stress of having children at home and having to homeschool their children while trying to work at the same time, and just kind of doing that whole setup is very stressful on people. There was a lot of people, 29 references, that were content from working from home and actually wanted to continue working from home after the pandemic is over, which I thought was pretty interesting. There's definitely technological problems needing better computer skills and tools to transition their work online. And there was a big discussion about work should be covering the cost of working from home. If they say, we have to work from home, we need good internet, we need good technology, and they felt that their work should be providing that for them. There's a quote that I pulled out. It's that childcare has been a huge issue. We're a two-parent, three-child household. Both parents are still working and trying to simultaneously school our children. It's an exhausting, never-ending logistical dance. Time management was one more theme. So people wanted more time or extended deadlines, so more flexibility and autonomy, especially people with children at home, having to balance that and work when they can. And the quote to the right speaks to that. It's being able to choose my hours from home to start earlier, like before my kids get up, so I can get it done and work on it once they've gone to bed. They wanted less micromanagement or unnecessary meetings and interruptions and allow them to do their work. Having a regular schedule was brought up a number of times. And also that they're spending such an extra amount of time on cleaning in the workplaces, and that they're not able to get the same work done because they're doing all these other cleaning protocols for COVID. They also wanted less or reduced workload and a fair distribution of work, and some felt that others weren't pulling their fair share well at home. So treatment of workers was a big theme. Respect was the most referenced with 63 references. And a lot of this respect had to do with the inclusion of frontline staff in decision-making in COVID policy discussions. They really felt that they had important information to relay back about making these decisions about their workplace and getting the respect in their voice. Bullying was brought up 15 times, even it's still a big issue, even when working from home or social distancing policies, fairness and equality, appreciation and positive feedback, compassion, and trust. So the two quotes I had is taking the suggestions and recommendations from frontline staff seriously, valuing frontline opinions and solutions to problems in the workplace, especially through COVID-19, and a company that puts their employees' health and wellness above money and politics, especially during the pandemic. So some information and training. A number of people were calling for the need for more information and more training and preparation for COVID. Staying informed with work decisions and plans and staying up to date. Many people talked about not hearing any information about what's going to happen at their work. Technology training, PPE training and how to use their PPE properly, procedural training around new procedures around COVID, and help transitioning work online. There's 26 references to that, and it was mainly from teachers and professors really trying to gear up for the fall and trying to get all of their work now online for the students and not having the skills to do so. Support was a big thing, and this came in a number of different ways. So financial support, there's 53 references to increased pay or hazard pay, recognizing essential workers that are placing their lives on the line. There's a call for more employees and staffing and not having enough staff at work to actually get the job done. 45 references to that. People wanted support from their supervisors and management. They wanted technical support, government support, support from colleagues, and mental health support, which we'll get into a bit more next. So this is a big quote, but I'll get through it. I thought it was kind of a powerful quote. So not only have these jobs become busier than usual, but the emotional labor that every single frontline essential worker is being burdened with right now cannot be understated. Whether doctors, nurses, customer service, daycare workers, etc., these are stressful times for us and for our families and loved ones who we come home to every day and share close quarters with. Despite these emotional stressors, that burdens us every single day. We are expected to perform our roles with a smile on our faces. I think every on-site front-facing essential worker deserves increased wages in addition to employer-provided PPE, including gloves and face masks. So again, with the mental health support, there's a number of references, 40 references to this. People wanted opportunities for self-care or paid mental health days, getting some time off. They wanted attention to stress and anxiety. And they wanted to really emphasize that COVID has added these layers of stress to their lives, and it's not getting recognized, they feel. And then there was discussions around vacations. It's an interesting time right now where people can't really go on vacations. They can't go up to their cottage in a lot of places. They can't leave the country. And this quote to the right also speaks to the busyness and how it causes them not to be able to go on vacation. So I would like to take some vacation time in order to support family and look after my emotional needs. I could return to work and be more effective. However, the work demands in my job are quite high right now. Okay, and there's a lot of call for just the access to do their work. 62 references, just being allowed or having the ability to work from home. Gaining access to the office or workplace to be able to do their jobs. So university professors trying to get into libraries and people just trying to get back into their offices. And there's a lot of discussion about, they were not able to communicate with patients, clients, and staff in person, and not being able to work face-to-face with people has created a lot of obstacles in them effectively doing their job. So just a couple more themes at the end here. There was a lot of references, 40, to job security. And the quote to the right here really speaks to that. Is, as a teacher by contract, assurances that my regular classes will still be offered in the fall. Otherwise, ongoing feelings of financial insecurity will be even more stressful. And there's a lot of talk about, what's my job going to look like in the future? Will I have a job, especially as a part-time contract worker? So leadership, again, was referenced 41 times, mostly to do with the direction of the company, the direction of the COVID policies, what's going to happen. And people are really looking for a strong leader in these times. Working with others, being allowed to work with others and to work in more teamwork, even if it's virtually, more collaboration with their colleagues. People were really wanting that and to create that teamwork aspect, even if they were working from home. And then just a general fear of returning to work. People don't know, is it going to be safe when they say it's allowed, that we're allowed to come back to work? And just the uncertainty around that causes some more fear. And that's everything, all the themes. there. If you have any more questions about this, please contact me at the email there. Thanks for your attention.
Thanks, Daryl. Yes, even the quotes that you included are certainly do resonate. There's been a few comments more in terms of one comment is that others have called it gratitude pay, not hazard pay, which is worthwhile. Catherine's actually asking about whether healthcare workers, although this wasn't specifically a healthcare worker survey, if people have been not denied the ability to take vacation based on the Emergency Measures in Act, and I don't know the answer to that question, so maybe somebody, if they know the answer, can type that in. Marty's actually asking if the qualitative data can be parsed further into the sort of categories that John and Peter were able to do around working from home, like working at work, working from home, or not working. And stratify by gender too is another question.
Yeah, there's that that data exists in there, so I could separate and create things based on those categories for sure.
Okay, that would be great. And Terry answers that vacations, in fact, are being controlled here for essential workers. And someone from BC actually is commenting that it's the opposite, that in terms of healthcare workers have been told to take their vacation